The new guidelines on heart failure of the European Society of Cardiology and Heart Failure Association move away from the stepwise approach on the treatment of patients with heart failure and instead suggest the initiation from the beginning or at any occasion with 4 pillars of therapies. And these are the ACE inhibitors or ARNI, beta blockers, MRAs, and SGLT2 inhibitors. However, questions rise on how these therapies can be implemented. And for this reason, the position paper of the Heart Failure Association of the ESC clarifies that the different therapies can be implemented in different ways, patients according to their profiles. One important profile is the one of patients with ischemic heart disease and angina. In these patients, first of all, we need to have values of blood pressure that are usually higher than the one we reach in patients with heart failure. The other thing is that in these patients we have to keep a lower heart rate, and therefore the guidelines on heart failure suggest that together with beta blockers, ivabradine should be used in patients with sinus rhythm in order to reduce heart rate. In patients with adequately reduced heart rate or in those in atrial fibrillation, other therapies should be pursued, and trametazidine and metabolic agents have a key role controlling angina in these patients. What is important is the personalization of medical therapy. This can be done only based on clinical judgment, on clear assessment of symptoms, and in patients with ischemic heart disease, keeping into account the severity of the disease.